There are zillion types of irregular heartbeat, but the one that really predisposes these people to have a stroke is so-called atrial fibrillation, AF. Now, the sudden death and irregular heartbeat may or may not related. Certain people have irregular heartbeat because of something else, because of underlying coronary artery disease. Those people have increased risk of sudden death. Now, if you look back from the sudden death back to the coronary artery disease, the narrowing of coronary artery divided into two groups. These people, if they have fixed deficit, what that means, if they have narrowing, those people can be fixed. But there are some type of coronary artery disease that the degree of narrowing is not very narrow. But these people, they have plaque rupture. That was different. Those people, they just suddenly have plaque rupture, bang, and they clot up the whole system. People who have plaque rupture, sometimes they don't have very narrow artery. So those people behave in two ways. If they routinely being assessed, and if they have fixed deficit in such a way that fixed, those people we can detect earlier. But there are another group that no matter what you do, you have no way to know that when it's going to happen. The plaque rupture is like the wall of our artery divided in 2 or 3 layers. The thinnest layer, which is the intractate layer, is very thin. And when people have high cholesterol, what happens? It does not damage this layer. It damages the layer below it. And what happens is it stretches this part, and it's like a stretched out thin wall. And in the bad day, this thin wall crack open. Once this thin wall crack open, our body try to repair ourselves by platelet, try to accumulate, cover this up. The problem is once it is out of control, the first platelet come, they call all the friends, the 10,000 platelet come, it just literally clot off the system. So the pathogenesis are different. The reason how it happened is different. So most of the sudden death, if they do not have fixed coronary artery disease, usually die because of this rupture plaque.